Hi everyone and welcome to the channel Study Nursing by Sense Schools. Today in this video we are going to discuss about 10 short questions on microbiology. We have included 10 multiple choice questions which belongs to microbiology primarily towards the basics of the nursing. So if you're interested in taking the quiz, jump on, have a look and spend some 5 to 6 minutes in participating in the quiz and evaluate yourself for the knowledge you have as a healthcare professional. All right. So I hope you are ready to have a look at it. Let's jump on to the first question. Which of the following is the primary component of bacterial cell walls? Is it lipid, peptidoglycan, protein, or nucleic acid? Let's wait for 5 seconds. All right, so the answer is peptidoglycan. Let's move to the second question. What is the function of bacterial flagella? If you are trying to remember what the flagella is, it's a cilia-like structure. It's a hair-like structure which is found around the body of bacteria. So let's have a look at the option. Is it the synthesis of protein? Is it DNA replication or locomotion or movement? Or energy production. So now that I've described what flagella is, what the structure is, some of you might be guessing what it is. Let's move to look at what the answer is. The answer is locomotion or movement. That's a structure that helps the bacteria to move. All right, let's have a look at the third question. Which of the following microorganisms is classified as a eukaryote? Is it bacteria, virus, fungi, or archaea? Let's have a look at the answer now. There you go. The answer is fungi. All right, there we go to the fourth question. Which bacteria is mostly associated with the nosocomial infection, or commonly called as HAI, or hospital or healthcare acquired associated infection? So, is it strep or Streptococcus pneumoniae? Is it B, E. coli or Escherichia coli? Is it C, Pseudomonas aeruginosa? Or is it D, Staph or Staph aureus? Let's have a look at the answer, but I'll give you 5 seconds to think about it. All right, here we go. The answer is staph or Staphylococcus aureus, which is responsible for the most of the infections associated. So it's a bacteria which is mostly associated with the HAIs in the hospital. All right, let's move to the next question. Which of the following best describes an obligate anaerobe? So before you answer the question, let's have a look at the terminology used. It is anaerobe. Try to have a thinking on the difference between aerobic and anaerobic. Again, there is a verb that goes in front of anaerobe, that is obligate. So what does obligate anaerobe means? Does it mean that it can survive in the presence of oxygen or cannot survive in the presence of oxygen? Or does it mean that it requires oxygen for growth, or does it mean that it can switch between both the condition? So let's have a look at the answer, but I hope in most of the cases you might have got it right. And the answer is option B, that is, it cannot survive in the presence of oxygen. That's why it's called anaerobe, obligate anaerobe. Let's move to the next question. Which staining technique is used to classify bacteria into gram-positive or gram-negative? So, if you are someone who is used to be studying antibiotics, or especially when you are in the beginning years, if you're posted in microbiology or path labs, you might already be knowing. But if you still don't know, try to have an idea, try to have a look at the question and how it is modified. The question is asked in the way that it reveals the answer. It asks you the gram positive or gram negative. What is a technique? So it specifically has the answer in it. I'm going to read out the options for you. Is it acid fast stain technique? Is it endospore stain? Is it gram stain? Or is it simple stain? Most of the cases, the answer is right, and that is Gramstein. Yes, well done. Let's move to the next question we have here. Which type of immunity involves the production of antibodies by B cells? Is it cellular immunity? Is it innate? Is it humoral? Or is it passive immunity? Which is a type of immunity that involves the production of antibodies by B cells? And the answer is humoral immunity. All right, let's move to the next question. Which of the following is a common nosocomial infection? Is it cholera? Is it malaria? Is it UTI? Or is it chickenpox? So, which one is common? So, if you when you think about the answer, chickenpox might not be common in the hospital. The remaining three options, cholera, malaria, and UTI, you don't often see malaria as the most commonest infection in the hospital. So the option comes as cholera and UTI. What do you think is the most common infection in the hospital? And the answer is UTI, or urinary tract infection. All right, let's move to the next question. Which of the following method is most effective for sterilizing surgical instrument? Is it A, boiling, B, autoclaving, C, alcohol swabs, or D, UV radiation? Again, try to have a look at the question and how it is asked. It's asking about the most effective among all these options. And your answer is autoclaving. All right. So let's move to the next question and the last one. Which microorganism causes tuberculosis? Is it staph? Is it Mycobacterium tuberculosis? I was thinking about Microbacterium tuberculi. I don't know if it's still used. It's been a lot years since I graduated, and it was like almost 18 to 20 years ago when I studied. I was having that term in my mind, so excuse me for saying that. So, Mycobacterium tuberculosis, is it Salmonella typhi, and Clostridium difficile. So, when we were learning nursing, we had this specification or option as Mycobacterium tuberculi, just like Salmonella typhi. So I was thinking about that. All right, so let's come back to the question, which is self-explanatory, and of course you might have got the answer by now. Which causes tuberculosis? And you are 10% right. The option is Mycobacterium tuberculosis. That's the microorganism that causes TB. All right. So, with this, you have completed the quiz. I hope you have got most of it as right. Make sure that you subscribe to the channel for more knowledge related sessions. We have got care plans, we have got anatomy related videos, we have got short notes and drug studies. All that is useful for nurses to study and grow in the field. So make sure that you give your comment and let me know what else you expect in the channel to be learned as. I wish you all the very best and thank you so much for your time for watching this video. All the best.